Hello, Sean Willingham with Highway 65 Insurance, the road to Medicare. Today, I'm going to give you my 5-minute Medicare talk. So I'll share my screen here. All right. Couple of really quick housekeeping items. Medicare premiums. When we talk about Medicare premiums, that's the amount that the federal government charges a beneficiary to be enrolled in Medicare. Okay. Medicare premiums are based on income from 2 years prior. Today's discussion is going to be focused on the two different types of Medicare, which we'll talk about here very shortly. But the important thing to note with respect to Medicare premiums is, regardless of which type of Medicare plan you choose, of those two types that we'll talk about here momentarily, regardless of which one you choose, the premium that would be charged and any income adjustments, if any, would be exactly the same. So it has no effect on the discussion of which type of Medicare, which of the two types of Medicare should I choose. So regardless, the same with either type of Medicare. The second housekeeping item is core health insurance benefits. I'm going to use that term. What does that mean? When I say core health insurance benefits, I'm talking about things that are traditionally covered by health insurance. So that's going to be medical bills, like going to the doctor, having a surgery, going to the emergency room, being hospitalized. That falls under medical services when I talk about core health insurance benefits. Second thing is prescription drugs. That's going down to the pharmacy and getting your prescriptions. And then the last category on core health insurance benefits would be your dental, vision, and hearing benefits. So that's what I mean there. Like I said before, there are two ways to get Medicare, okay? And it's important to note here that a person never has both original Medicare and Medicare Advantage. A person always has one or the other. You cannot have both at the same time. So you have to choose between original Medicare or a Medicare Advantage plan instead of original Medicare. So we'll talk about original Medicare first. With original Medicare, the federal government is the primary payer of medical bills. Okay. Now, in my opinion, the reason why individuals that choose original Medicare, the reason why they do, is because they're in search of having the most control over where they go to get their medical care. Because with original Medicare, there is no network. You can simply go to any provider, that's a doctor, hospital, specialist, lab, whatever, any provider. You can go to any provider that takes original Medicare. No network, no primary care, no referrals. That's how that works. And that's the primary motivator for people that are on the original Medicare program. But the federal government's only going to pay 80% of the bill. So with original Medicare, it's important that 3 additional products are added. The first of those 3 products is called Medicare Supplement, sometimes referred to as Medigap. Those are synonyms. They mean exactly the same thing. That's simply a policy purchased from an insurance company. And then now that insurance company is responsible for the 20% gap on the medical bills. So Medicare pays 80%, the supplement pays 20%, 80% plus 20% is 100% coverage for the medical bills. The second additional insurance product is Medicare Part D or prescription drugs. So you have coverage to go down to the pharmacy and buy medications. Then the third category is dental, vision, and hearing benefits. So with original Medicare, primary motivator, control, government pays 80%, and then you add those 3 additional products to provide coverage in all those core health insurance categories. Now, Medicare Advantage. Why do some individuals choose Medicare Advantage instead of the original Medicare program? So a Medicare Advantage works like this. An insurance company combines together the core health insurance benefits like medical, prescription drug, dental, vision, hearing, and usually they even add some extra things that are specific to that plan. But they do combine together the medical, prescription drug, dental, vision, hearing for on the vast majority of plans. And so individuals that choose a Medicare Advantage plan, the reason why, in my opinion, that they choose it is because they're in search of a bargain, because it's one health plan from one insurance company. Now, with Medicare Advantage plans, the vast majority, you do have to use providers that are in the network. Okay. You use the providers that are in the network, and some can have additional things like having to pick a primary care or referrals to see specialists. And then the other part about a Medicare Advantage plan is that when a person that's on a Medicare Advantage plan has a service, there is an out of pocket associated with that service, an out of pocket, a share in the in the bill. Okay, and that out of pocket on the medical comes in the forms of deductibles, co-pays, co-insurance, but there is always a maximum out of pocket. That's the maximum cumulative out of pocket expenses that that individual can have in a calendar year. But that is the 5-minute Medicare talk of original Medicare versus Medicare Advantage. If you like the video, please subscribe to our channel if you want to learn more about Medicare plans and Medicare options in the future. Thank you very much. Have a great day.